So hello everyone, I have a wonderful patient from New York, and you are 4 days out, literally I would say 96 hours or so plus minus. Now let me you had grade 3 capsular contracture right and left, you had 360cc implants, and you had the surgery done in 2017, what are saline implants, and these were below the muscle. Now let me ask you this, how was your pain post-op?
Pretty minimal.
Out of 10 pain, how much pain do you have now?
0.
0. Let's say on Friday, the day after your surgery, how much pain did you have the next day?
Maybe 2 or 3.
2 or 3. And you know, I have to say you chose to get the Exparel. How much is the Exparel? That's like the local nerve block that works up to 72 hours. And you really did not have to take the pain medication, the narcos. Remember, all of these meds, they slow the gut down. You didn't have to deal with the constipation. And I will tell you, every surgery that's done in the United States or in the world should use Exparel. So why take pain meds after when you can have a local nerve block? It's unfortunately cost prohibitive. How do you feel post-op versus before? Like, how are your symptoms?
Night and day.
Really, tell me how you have improved. Now remember, this is way too early. This is just you're fresh after. Now there is a certain, whenever I get a testimony, I always tell the patients, here immediately the first they're off, because you get to learn a lot, and then at 3 months, 6 months, 9 months, a year and a half, because that's how long it takes for ultimately. But the first 3 months, if you ask me, the first 6 to 8 weeks are key, because that is the recovery period. But what have you noticed post-operatively?
One of the main reasons is when I got the implants 5 months after, I started getting spots on my face. I went to my doctor. First, he told me it was basal cell carcinoma. So he sent me to a dermatologist, and she just looked at me and said, "Oh, you just have rosacea." So obviously I was getting autoimmune diseases or conditions from the implants. And almost 8 years later, they were debilitating. The rosacea, the redness in the face. And post-op, since just Thursday, it has cleared, a lot. My husband keeps saying how clear my complexion is, and it has not been clear in 7.5, 8 years. The other thing is I had rashes under both arms for at least 6-8 months. My doctor could not figure out what it was, wanted to put me on medicine for it. I did not take the medicine, but I itched and I itched and I itched. I have not itched once since having my implants out.
No, very important. I see we will hear this from you maybe in 3 months, 6 months, because we want to see how it does with the test of time, right? Because that's ultimately the answer. Now, I have seen this so many times. It's even one of those symptoms of breast implant illness on the questionnaire, about rash. There is a you remind me of a patient, a nurse, a PhD nurse that I operated on many years ago. We have a YouTube of her and a very prominent rash on her breast. And as soon as the implants were removed, that rash dramatically improved. And this is that reactivity to a foreign substance by your body. And this is this was the most significant complaint that you had.
Yeah.
Now, let me ask you, sorry, you were about to say something?
I was just going to say one other thing, and again, I'm not sure, but my eyesight has declined exponentially in the last few years, and I do see that that can be a condition of breast implant illness. I did put in my contacts yesterday, and I could barely see, so I don't know if my eyesight has improved quite a bit or what, but it's definitely changed.
So changed how, if you can explain?
With the contacts, and I can't really see. Everything was blurry when before I wore them to my pre-op appointment with you, and I could see perfectly.
Okay, so what I want you to do is I want you to go and get an eye exam, because many patients have stated, now not my words, the words of the patient, that they can see high definition much clearer. And so we want to see certainly that you're able to get this exam so that you can clearly see it, because that's very important. Yes. So many patients report improvement in their eyesight, especially the dryness of the eyes and the clarity. Now, these are the words of the patients, not my words. I doubt any textbook on earth even talks about this. Now, the next question is, how did you end up choosing me? Like, okay, let me ask you this. When did you first hear of the word breast implant? Unless it was the implants.
Sorry. I struggled for a lot of years wondering what was wrong with me. The doctors just kept telling me, you're stressed, you're getting old, you're losing your hair, you're losing your eyesight, your body aches, all these ailments. But I knew there was something more wrong with me. So, like I said, I got the implants in 17, struggled up until March of this year. I wanted to do some fasting to try to maybe help my body. And on this fasting site, one day, and I did some research, and there was this poster. It says, "Are your breast implants making you sick?"
A poster.
It was just like just a little graphic on the website when I started delving in, because I had stomach aches for months and months, and I told my doctor after he said I'm fine. They did blood tests, stool tests, everything is perfect. I told him and my husband and my family that I'm going to find out what's wrong with me, or I'm going to die trying. So I delved.
You knew something was up.
Oh, I knew there was something wrong with me when my doctors kept telling me I was fine.
I will say this, let me jump in. The patients have always said they knew their body and they know they're not crazy or they're not losing their mind. All
Right.
these lab tests that come back negative, there's something more. So your gut is not kind of misdirecting you.
Right.
Please go ahead.
And I was taking care of a couple ill family members. Was I stressed? Yes, absolutely. And they kept saying, stressed, you're getting old. But I knew it was more than that. So I delved into the computer and I came across that graphic. And so I looked up breast implant illness. And
This was March.
This was March of this year, after so many years. And it took me to YouTube, and I believe it took me to some of your videos, and I just searched the symptoms. And as I told my husband and my kids, I probably watched 200 breast implant illness videos, breast explant videos, and there was a couple different doctors, but I looked, I think the other one was in California. But I did look into yours, and I read all of the reviews from the patients. I just did my due diligence. And after watching those videos and those women they were explaining my life. So I was certain I found out finally what was wrong with me.
Got it. And we'll hear from you. We'll do a Facebook Live if you're ready, like 3 months, 6 months out, just so that we can see post-operatively how you're doing. Now, one thing is absolute guarantee. You saw the pictures and the videos, that complete, total, sincere, honest capsular removal off of the rib. And there was another extensive part of what is body, chest, breast contouring that I did. And so that is the first thing that was done. You clearly did not need drains. Now, let me ask you this. From what you saw right now, do you think you needed a lift?
The contour, I did not need the lift.
Yeah. And clearly, I will tell you, hands down, just looking at you, overall, you're 57. If you look at, this is your natural you minus that, the severe inflammation stretch marks that you had, and you clearly were not a candidate for a lift. And that is reassured. Yes, you're postmenopausal with the large, relatively speaking, implants. You still, in my mind, and as you can see, and you will see, you were not a candidate for a formal lift. Now, one last question for you. What would you say, any last words of thought that you have for anyone else who's listening?
Don't do it. Just don't do it. Be happy with yourself, and listen to your body, and don't listen to your doctors when they tell you nothing is wrong with you, because you know if there is something wrong with you.
Yeah, these were supposed to be the safer, better, nicer implants, the saline, and look, they cause the same hurt as silicone.
We asked all the right questions to the lady who did them. And I did get them because I had lost so much weight, and I was so active, and I was running, and all I had left was skin. And I guess I just thought I needed to look better. In today's society, we all think, we're not good enough, but we really are.
No, do no harm. Overall, at the end of the day, it's not worth it. This is echoed by all the patients, if not all the patients, who have said they wish they had not gotten implants, number one. And number two, they wish they had removed them sooner.
It took 8 years of my life. It stole 8 years of my life. Gone.
Yep. No, and thank God it was not 10 or 16 or 20. Some patients, I talked to a patient I reviewed the file on a patient who had implants from 1982. And so I'm going to be operating on her in the next week. And the bottom line here is, do your homework, do your research. This is what the patients are doing. They're overriding their local doctors and their local plastic surgeons and taking this medical executive decision to proceed with surgery using their knowledge and intellect, using their minds and wisdom, and realizing what the problem is. Now, that was very strong. Thanks for sharing your journey, and I'm sure it will help a lot of ladies understand that there is more to it than what they're seeing at the surface. This is a very evil disease.
It is very evil
because it tricks and evades and hides and fools a lot of people into thinking that the implants are safe. No, they are not. There's the silicone reactivity. The rash is a very clear example because it's telling you something is up. So, no, thanks for sharing your journey, and we'll continue to hear from you.